ICU survival rates are improving, but what happens after the discharge papers are signed? A new study published in Critical Care, Yu et al., 2025, suggests something alarming. Patients who develop depression or anxiety after ICU discharge have a significantly higher risk of death in the years that follow. Let's break it down. This was a nationwide cohort study from South Korea using insurance data on over 799,000 adult ICU survivors between 2015 and 2019. Patients were grouped based on their mental health diagnoses. Those with depression or anxiety before ICU stay, those diagnosed within a year after ICU discharge, and those with no history of either. The question was simple. Do depression or anxiety, especially new diagnoses after ICU, predict long-term death? Here's what they found. 12.3% of ICU survivors were newly diagnosed with depression or anxiety after discharge. This group had a significantly higher mortality rate over the next 7 years. Let's talk numbers. New depression. Adjusted hazard ratio, AHR, of 1.28. That's a 28% higher risk of death compared to those without it. New anxiety, AHR of 1.08. Pre-existing depression, AHR 1.12. Pre-existing anxiety, AHR 1.04. The highest risk wasn't in people who already had mental illness. It was in those who developed it after ICU. Let's pause here and explain this. AHR stands for Adjusted Hazard Ratio. It compares the risk of dying over time between two groups, in this case ICU survivors with versus without mental illness. The term adjusted means the data has been statistically corrected for things like age, comorbidities, type of ICU illness, length of stay. So when we say AHR equals 1.28, we mean that even after controlling for other variables, patients with new depression had a 28% higher risk of dying long-term. This raises a big question. Why would depression or anxiety after ICU increase mortality? Here's what we think. Post-ICU depression is often part of post-intensive care syndrome, or PICS. It may reflect underlying brain injury, sleep disruption, or trauma from the ICU experience. Patients may withdraw, stop rehab, skip follow-ups, or avoid medications. Depression may also worsen inflammation, suppress immunity, or delay recovery. It's a vicious cycle. The mind affects the body reinforces the mind. This study delivers a clear message. Mental health is a survival issue, not just a quality of life one. As ICU doctors, what can we do? Screen survivors for new depression or anxiety, especially in the first year. Educate families about red flags to watch for. Refer early to mental health services or post-ICU follow-up clinics. Advocate for multidisciplinary rehabilitation that includes psychological support. What makes this study powerful? Massive scale, almost 800,000 patients, real-world data across years, strong statistical adjustment. But there are limitations. They only measured diagnoses, not symptom severity. No insight into cognitive or physical recovery. It's observational. We can't prove depression caused the deaths. Still, the signal is strong, and the call to action is clear. This study tells us something we can't ignore. Post-ICU depression kills, especially when it's new, silent, and untreated. Surviving the ICU is just the beginning. Recovery is more than discharge. It's mental, emotional, long-term, and it starts with noticing. Subscribe for more studies in 10 minutes or less.